Hey, this is Dr. Greg with Canyon Lake Physical Therapy, and I'm here to talk to you about pelvic floor today. So what is the pelvic floor? I'll show you here on the skeleton. It's a bunch of muscles that support the bottom of your pelvis that have important functions of supporting the organs inside that pelvis. So the functions of this pelvic floor, they help with bladder control, sexual function, and they also have a coordinated movement when you breathe. So when you take a big breath in, what happens is your diaphragm moves up. So to control that pressure in that intra-abdominal area, your pelvic floor also has to move up. And then when you exhale, your diaphragm relaxes and moves back down. And then your pelvic floor also has to move down with it. Why should you strengthen your pelvic floor? Well, if you ever heard of anyone that sneezes and they accidentally leak, or if you have low back pain, sacroiliac joint pain, or pelvic pain, you can also strengthen the pelvic floor to reduce that. If you're planning on having a baby or you just had a baby, it's important to strengthen these muscles to prevent pain, reduce weakness in that area, and you can do that through exercise. So the first exercise is a Kegel. 2 cues that we can give to perform a Kegel exercise is it should feel like you're trying to stop the flow of urine or you're trying to stop from passing gas. So the best way to perform a Kegel is on an exhale when you're breathing. So when you inhale, your diaphragm is lowering. So you don't want to perform a Kegel during that motion of the breathing. When you exhale, it moves up. So then you're able to contract those muscles with those cues I gave you earlier, perform a strong contraction. The next exercise is a bridge. And we're gonna perform that with something that's called a posterior pelvic tilt. And I'm gonna show you here on the skeleton what exactly you're looking for. So you have these bony prominences here on your skeleton right here. And you can actually feel those on yourself. I'm gonna stand up and show you. So you can feel those right here, right in the middle of your stomach right there. That is the front of your pelvis. So what we're gonna do is we're gonna try and tilt this pelvis backwards during that bridge. So I'll show you right here. Find those bony prominences. What you're gonna do is you're gonna tilt it back. So keep in mind, you wanna do this tilting of your pelvis backwards before you perform the bridge. There you have it, 2 strengthening exercises you can perform for the pelvic floor. If you have any comments or questions, please put them in the comments down below and I'll be sure to answer them.